summary skill, we have to summarize the less important detail. So for the sake of example, like if I could categorize the letter into two format, I would say that just in general format, the first one is the improvement, let's say, and second one is the worsening. Let's say, how would I say in generally speaking, I would categorize the letter of improvement as a discharge letter, right? And the letters where we have the worsening of condition as the referral letters, right? So normally we can see if it's the improvement, we have certain thing as we discussed in last classes, such as ward details. We may have the rehab maybe details or the nursing management, right? We have ward, rehab or nursing management and the we can say improvement or the discharge letter, or else we also have the discharge plan. So basically, if you can see there that the part I would highlight right now in the bracket one, this part need to be summarized. For the sake of example, if you can see there, the highlighted part that I just have highlighted over here, this part need to be summarized. I just have to understand that I need to summarize this part only, right? So just summarize this part. In case if we are writing this letter of basically, so let's say in case of discharge letter, we have discussed that we have certain history, certain things that we can say, such as ward or rehab. It should be written in a summary form. And in case of referral letter, we have treatment record. For the sake of example, there is a possibility that first, let's say 2 visits or 3 visits will be less important. What I mean by that, here we have, you can say some mild symptom of the disease. If it's the progression of the condition, let's say the patient is a suspected case of diabetes as of the last visit, but initially we have just mild symptoms. So in the first 2 visits, we have mild symptoms. And let's say in the third or fourth visit, we have, let's say, worsening of the condition, and even path shows some sign of, let's say, such as HbA1c in case of diabetes. So you can see there, as we discussed, that for the nursing management that I've highlighted, and in the case of referral letter, if you have less important detail, let's say mild symptom, you have to summarize these two things in a letter of referral or in a letter of discharge, right? So these two things need to be summarized whenever you're writing a letter. But which tense is being preferred when you have to summarize? In case if you're writing a letter, you need to see that I have to write it down, the letter in which tense. For example, in case of summary, we'll prefer to write in perfect form. So either past or present. Maybe past perfect continuous, present perfect continuous, or simple past perfect or present perfect. So whenever you are summarizing, we have to use this tense. As you can see that in case when we are summarizing the history, we have certain options. First of all, we have multiple visit, right? So there could be repetition of event. There will be a consistent condition, such as you can say, I would say, like diabetes running from the last 5-10 years. Let's say we can also use the present perfect continuous tense for that, right? We have the progressive or change in condition. we can also use the present perfect tense or past perfect tense depending upon the event. So here we are going to discuss about the summary skill. Summarization does not mean to omit anything important. Fine. It is also important to remember that like candidates, when they try to summarize, they will try to miss some important information. It's not the case that you're going to miss important information. You just have to write like a summary, and summary always has to be done in view of today's situation. Whatever you're summarizing, you have to summarize in view of today's situation. So in practice, I'm gonna share a task with you. We are going to practice that with you in a moment. If you can see that we have a lot of information in this part. Let's say in this case, the patient is being discharged from the hospital. The patient had a successful right knee replacement surgery. He had the ward stay that I displayed in front of you, followed by the rehabilitation, and now the patient is being discharged. So this part of the information that I brought in front of you, I clipped this part from the letter so that we can understand the how to summarize it. So at the moment when we are standing, it's something, the patient is vitally stable, his mobility has improved, for example, and he has been discharged maybe some exercises or with some medication. So from today's perspective, the post-operative ward stay will not be that much important. But let's say if we can read it in detail, then you can see that he returned to ward after the surgery. His vital signs, blood pressure, pulse rate, temperature, they all are normal. Circulation was fine. And in order to improve the circulation, we have to have the pillow. His HB was low, hemoglobin. Therefore, we have given IV transfusion. Then these are some medication that you prescribe in the hospital, some painkillers maybe, right? So then we can see on the next day, then we have wound goods, sponge. We have started warfarin and medicines that has been given. Pathology was ordered. They revealed that HB has improved. You started with Veritab and so on. Then after 1 day, we started this medicine. Warfarin started. We can say removal of dressing wound and art clips, clutches, wound growth ephemeral, Clexine, ATMG given, right? So still we can see there no. Anyhow, still we can see there we have you can say on first we have some information, then on second X-ray, blood, everything was normal. INR was 3.0, hemoglobin was 111, ECG this was normal, managing with minimum assistance, and we can see that the patient was transferred to the rehab. So now first of all, we would like to summarize this part. It's very important for you that all the details written in the paragraph is less relevant. So I will show you the summary that we have done today. How do we do it? Let's a minute, please. There's a lot of information we just have covered in these few sentences. I think it's around 40 words we had covered. Even, it can be more summarized, right? It can be more summarized. We can just write it down post-operatively. Mr. Johnson stay in ward remain uneventful apart from intravenous blood transfusion, right? He has been transferred to the rehabilitation after. Yeah, we can just close it over here, and we can write it over this line over here. After successful completion of ward stay, he has been scheduled for the rehabilitation transfer. Where we can write it down with that anyhow. you can see this is the summary of that picture that I sent in the group and that I had displayed earlier on. So you can see the lot of information we just have summarized. So it can be summarized in this way. His stay in the ward was uneventful. That's it. His stay in the ward was uneventful. It can be written, you can say just like that. Only that particular information, right? So I hope it's clear to you. Okay, yes, we can, ma'am. We can, no issue. We will put the music. Now, this part of the letter is the rehabilitation. Rehabilitation part should also be summarized, but importantly, what you can understand from this rehabilitation part is that it should be summarized, but less than the ward stay. Fine. So after ward management, we can see there that he was, stable at the time of admission in the rehabilitation, right? He was stable the time of rehabilitation, you know, and this was the exercises, or sorry, this was the techniques that can be used, that was used in the rehabilitation. Sorry, the frame, stick, pull, gentle exercises, showering with minimum assistance, X-ray was ordered, let's say, and Aina revealed this. For these reasons, you have reduced the medicine. HB was improved, reduced the ferry tap, uneventful, gradually becoming independence. So you have to extract the crux from this information, and we can also summarize this thing down. So I'll show this part. So now we can see this part is the rehabilitation part. We can also just merge these two paragraphs together as well. But independently, I done this thing intentionally to make you understand. You can see majorly I'm using the perfect tense over here, right? Majorly. When we have to differentiate an uneventful except that he had low HB, this was for past and this was near past. That's why I've used was. Anyhow. So that is your ward stay. Now this is your rehabilitation. And try to include all the things that was mentioned in the rehabilitation. If I miss something, I will add it. Let's say pool was missing. Anyhow, she was also assisted with minimum assistance for showering. And I try to just expand it a bit. But if I want to summarize, I can summarize that as well, right? Okay. So this was the summary of your rehab, let's say. Now we can show you, let's say that discharge plan as well. Now this is the last part, and the most important part is the discharge part. At the time of discharge, there was no cardiac issue, right? He was discharged with minimum assistance, home nursing assistance, sorry, with home nursing assistance, specifically for personal hygiene and home care. Her wound is exposed. He was able to take shower with minimum assistance, and the patient was advised to use stick or frame as per need basis. Fine. So afterward, these are some medication such as warfarin 4 mg, Peritab, and all these things can be written. And then we have rehabilitation appointment booked, and FPE and INR was also requested to be repeated. So in this regard, we can see that this is your the last part. For example, at the time of discharge, she is vitally stable. Therefore, consequently, she is being scheduled for discharge. She has been provided nursing assistance in order to have personal hygiene and home care. Her discharge medicines include warfarin 4 mg, which has to be given at night, Peritab once in the morning, and all these things should be written the way it has been presented, right? So then we can write it down. She has been advised to see you after 1 week in order to repeat her full blood examination INR, as her last INR was 3.8 and hemoglobin was this. Please note that her appointment, not, let's say, after 2 weeks. So you can see, majorly, this is the major chunk of the discharge letter that we discuss. We can add the conclusion, maybe, or maybe the introduction to complete this letter. So the major task of this introduction was, letter was, you can see that the lot of information that was originally written in the word, like a lot of information, and we just have summarized, right? Then we have rehabilitation. It's more than the word stay. Fine. So I hope it's clear to you. Or if you like to ask any discussion, we are going to discuss this case when we have to summarize. Right now, we are writing, I'll just repeat it for you because I have not recorded. Right now, we have to see that we are writing this letter to the emergency registrar. The reason of referral is these are differentials. The first one is AMI, the second one is APO. We are suspecting those two things, and parallel we have worsening of asthma. In this regard, we can go on and read the case. Now you can see, as the patient presented to my clinic, let's say initially, the patient presented with mild chest pain and mild asthma. The intensity of the symptoms are mild in nature. As if view of the discussion that we had previously, we understand that this part need to be summarized. Anyhow, we'll go on and read. There is a negative family history. That is also important. Patient is under significant stress. It's also important. Let's say medication that he has been taking, fine. And at that time, there was nothing significant detected. And we have made the early stages of ischemic heart disease. And there might be the DD of chest pain, stress related. At that time, we have planned for something, and the patient has been scheduled to see you again after 1 week. After 1 week, he came again. Still, he's having occasional chest pain or exertional chest pain. In this regard, symptoms are not that much serious. They're mild in intensity. However, the asthma has been worsening, right? So you can see there the worsening of asthma. There was slight ischemic changes, important point. Restore was increased, important point. You have ischemic heart disease or upper respiratory tract infection. This was the management that has been done. And you ask the patient to see you after 2 weeks. 2 mean after 2 weeks. So we can see there, the next week he came again with a chest pain. So in view of chest pain history, is still the, you can say, mild in nature. His asthma has been worsening, actually, I can see there, right? And now he presented again on today visit. Basically, it was not a planned visit. He was just passing by the center when he had this pain, right? So as per your question, we can understand that we have to summarize the first three visits, like 5-5-11, 12-5-11, and 26-5-11, right? So this is the summary of the visit that we discussed. That was the main chunk of the discussion that I selected after reading that paragraph. That main chunk was there, and now we can see that this was the summary that has been done, right? So we have to summarize the less relevant detail. Okay. So I hope it's clear to you. This was a summary of the task that we discussed.